there's another element to safety, and that is if you vaccinate someone and they make an antibody response, and then they get exposed and infected, does the response that you induce actually enhance the infection and make it worse? And the only way you'll know that is if you do an extended study, not in a normal volunteer who has no risk of infection, but in people who are out there in a risk situation. This would not be the first time, if it happened, that a vaccine that looked good in initial safety actually made people worse. There was the history of the respiratory syncytial virus vaccine in children, which paradoxically made the children worse. One of the HIV vaccines that we tested several years ago actually made individuals more likely to get
COVID news here, Dr. Ashton, the big news. You've been talking from the very beginning. You've been talking about COVID and vaccines as it relates to pregnant women, and some more big news in here now.
Really big news, and so important again, this is not a one-size-fits-all pandemic or virus, and this is a very important group of people. 4 million births in this country a year. ACOG, the American College of OBGYN, now strongly recommending that all eligible women get vaccinated. This includes women who are pregnant in any trimester and or women who are breastfeeding. Why did they finally make this sweeping recommendation? Now they have enough data. Tens of thousands of women who were pregnant and received the vaccine, establishing the safety profile of these COVID-19 authorized vaccines. And because the risk is so high, pregnant women are at increased risk of hospitalization, complications, and death due to this virus.
And people certainly know you're board certified OBGYN. What else jumps out at you now that pregnant women need to keep in mind?
Well, a lot of moving parts here. So for a woman who is pregnant and hearing this news or considering being pregnant, you don't need a pregnancy test prior to getting the COVID-19 vaccine. All 3 authorized vaccines cannot, I repeat, cannot change our DNA or cause miscarriage. So that should reassure people in terms of the risk and in terms of the benefits. There is early published data that suggests that antibodies that a woman makes after receiving the vaccine can be passed to the fetus and the baby. So good news.
Thank you, as always.
The things I've reported that the volunteers have found, what I'm about to share is probably the most disturbing and the most important. Basically, this report written by a female physician analyzing the documents shows that pregnant women were excluded from the trials before they concluded it was safe and effective. They concluded it was safe and effective based on mice and the autopsies of mice fetuses, and that horrifically, the Department of Defense data shows that female soldiers' pregnancies are experiencing an absolutely catastrophic rate of abnormalities and fetal problems. So it's so important. I'm just going to read it. It's super fast. She says, to date, there have not been any human clinical trials. This is really real, what you're hearing, conducted by a COVID-19 vaccine pharmaceutical company to determine if vaccines are safe during pregnancy or while breastfeeding. All emergency use authorizations exclude pregnant women, and no COVID-19 vaccine has been approved for use during pregnancy. Astonishingly, however, she says, many professional organizations have strongly advocated despite that pregnant women get this vaccine despite any lack of safety data. And what she points out is, thanks to the court-ordered release of the confidential Pfizer documents, which the FDA wanted sealed for 75 years, we have learned that pregnant women and breastfeeding mothers were excluded from phase 1, 2, and 3 of the human trials. One recently released Pfizer document lists 21 groups of people who were excluded from all phases of the Pfizer trials and specifically singles out, quote, women who are pregnant and breastfeeding as not able to participate in any of the trials. And she gives the citation. Despite this, the American College of Obstetrics and Gynecology, the Society for Maternal Fetal Medicine, all of these obstetrics and gynecological organizations were strong advocates for vaccinating pregnant and lactating women. And even though none were approved. How, she asks, could they possibly be promoting an experimental untested vaccine for pregnant women? As it turns out, their clinical recommendations are based on a faulty study conducted on a few dozen rats in France. Before any research trials can be performed on human pregnant women, a new drug must first be tested on pregnant animals. These are called developmental and reproductive toxicity, or DART studies. They state that the DART studies for the Pfizer-BioNTech COVID-19 vaccine have been reported in Europe, and according to these animal studies, they don't indicate direct or indirect harmful effects with respect to pregnancy, embryo, fetal development, or postnatal development. However, what was that based on? Given the extreme importance, one would expect the study to be conducted by independent researchers using a robust design. But she reviewed the study, and she writes, this is a doctor. She writes, it is astounding to discover that it was performed in a mere 44 rats and for a length of only 42 days. Then she gives the citation. To their credit, it turns out that rats are the perfect mammal to do pregnancy studies on because they only need 21 days from conception to delivery. So in the study, half of the rat pregnancies were terminated at day 21 by C-section, and the fetuses were removed from the mother and studied. The other half were allowed to give birth. And then they terminated the study. That's it. And she points out this is long before any developmental issues could have been observed in the offspring and precludes any long-term safety or fertility studies. This 42-day study on 44 pregnant rats led them to conclude that there were, quote, no effects on female fertility. But she points out there were two glaring problems with the study. It does not require the requirements of the DART study to make sure that they're okay into the next generation. So there's no way to know if there were adverse effects on rats. And the other huge glaring study is a disclaimer that I sent to your producer, which should shock you. She says there's no way these investigators could be unbiased. Why? They were employed by and held stock in either Pfizer or BioNTech. I'm going to say this again. The doctors who concluded based on 44 French rats that the vaccine was safe for pregnant women were employed by Pfizer or owned BioNTech and Pfizer's stock. They tried to hide this by using only initials instead of full names. In spite of that, pregnant women were encouraged to get vaccinated. So looking at the actual VAERS adverse event reports, what you see is that this had horrific outcomes. This section covering pregnancy and lactation on pages 12 to 13 reveals that 20% of the 413 reported cases of adverse events for pregnant women were, quote, serious. These include 25 miscarriages, 5 fetal deaths, as well as uterine contractions during pregnancy, preterm deliveries, premature rupture of membranes, and fetal growth restriction, meaning the babies could not develop fully. Also included were serious and less serious adverse side effects of breastfed babies that included infantile vomiting, fever, rash, agitation, and allergy to the vaccine. 6 women having adverse events who got the vaccine while breastfeeding included partial paralysis, suppressed lactation, breast pain, migraines, and breast milk discoloration. And Pfizer's response to the above alarming data in the secret documents was there were no safety signals that emerged from the review of these cases of use in pregnancy and while breastfeeding. The last thing I'm going to say in this shocking report is that this doctor also looked right there at the Department of Defense data, which has been exposed by 3 whistleblowers represented by Attorney Tom Rance. And what they're showing, again, I keep raising the question of, is this a national security breach? Is this a national security breach? Because we don't know the level of micrograms that were given to female pregnant soldiers in our military, or to any of the soldiers in our military, or sailors, or Air Force members. And that we've shown makes a difference, because when you get up to 100 micrograms, people get very, very sick. So in this database, they observed disturbing evidence of dramatic increases in serious medical conditions among military personnel in 2021. And among these are congenital malformations of fetuses. The rise in congenital malformations increased dramatically from a baseline rate of 10,906 cases per year to, in 2021, when female soldiers and sailors and pilots were being forced to take this experimental vaccine it rose to 18,951 congenital malformations for even part of the year of 2021. For part of the year of 2021, it nearly doubled the fetuses of our brave women, soldiers, sailors, Air Force members who were pregnant, who submitted to what our president said they had to do as the commander-in-chief, took this experimental vaccine. Their babies suffered. Their babies suffered. And this is a criminal attack on our military, on the brave women and men in our military. The NIH concludes that it's safe and effective in spite of these numbers for pregnant women. And she makes a final point that all of the spokesmodels use the phrase, the data suggest it's safe and effective. And she points out that the word suggest is one of those weasel words that really represents the lowest level of certainty, quote unquote, expert opinion. She concludes the evidence is clear that the potential risks of pregnant women getting vaccinated with the new mRNA COVID-19 vaccines, the far outweigh the benefits. And this is honestly one of the worst things I've ever seen in my 35 years as a reporter. This is an attack on American women. It's an attack on pregnant women, intentionally or not intentionally. The fact that Pfizer saw these data, the American Gynecologists and Obstetrics Organizations knew of this data, the FDA knew of this data, that, 44 French rats were autopsied and their fetuses are fine, so go ahead and get injected, pregnant woman who trusts me. This is a crime that every single mother, grandmother, husband, who cares about women of childbearing age should be horrified and appalled by. It is a major criminal act, and I really have to ask, knowing about this data and letting female soldiers take this vaccine and jeopardize the health and offspring of their children, which is going to tie up hamper our fighting capacity, right? If you're dealing with an injured, a congenitally abnormal baby and child, what is that going to do to our military preparedness? These are massive crimes.